Cory Booker thought he had Marco Rubio on the defensive. He came armed with claims that the Trump administration's cuts had weakened America's ability to detect deadly disease outbreaks in Africa and left the world less prepared for the next pandemic. But Rubio wasn't buying it. Almost immediately, the hearing turned into a tense back and forth as Booker accused the administration of reducing early warning systems and global health programs. Rubio fired back, rejecting the entire premise and insisting the United States is actually responding faster than before. What followed wasn't just a debate about Ebola. It became a clash over government spending, global health policy, and whether throwing more money at a problem actually produces better results. Senator Cory Booker opened his questioning by raising concerns about Africa and global health programs. He pointed to rising cases of tuberculosis, malaria, HIV, and the recent Ebola outbreak, arguing that cuts made by the Trump administration had weakened America's ability to detect and respond to dangerous diseases before they spread. Booker's warning was straightforward. In today's interconnected world, a public health crisis anywhere can quickly become a threat everywhere. He argued that reducing investments in surveillance, early warning systems, and disease detection leaves both Africa and the United States more vulnerable. But Secretary of State Marco Rubio immediately pushed back. Rubio rejected the idea that spending cuts were responsible for the Ebola outbreak, noting that the outbreak began in an isolated, conflict-ridden region of the Democratic Republic of Congo. According to Rubio, America's response was rapid and effective once the crisis emerged. That didn't satisfy Booker. He repeatedly argued that the administration had, in fact, reduced early detection and monitoring programs, making the world less prepared for future outbreaks. He claimed even State Department personnel had expressed concerns that America is less prepared today than it was previously. Rubio strongly disagreed. He argued that the administration wasn't simply cutting programs, but restructuring them. According to resources had been redirected into new arrangements that allow the United States to respond faster and more efficiently than before. At one point, the exchange became visibly tense as both men talked over each other. Booker insisted the facts showed cuts had occurred. Rubio insisted those cuts had not weakened America's preparedness and said that once current reforms are fully implemented, the United States would actually be in a stronger position than before. In the end, neither side backed down. Booker argued that reducing global health investments creates unnecessary risks and leaves America vulnerable to future crises. Rubio argued that effectiveness matters more than spending levels and that the administration's reforms are producing faster, more flexible responses to emergencies. What started as a discussion about Ebola quickly quickly became a larger debate about government spending, public health, and how America should prepare for the next global outbreak. Like and subscribe so you don't miss the next political showdown.